Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Okay guys, we're continuing our review of these 2025 official coding guidelines. All right, let me go to my outline. We're talking about sepsis and septic shock complicating abortion, pregnancy, childbirth, and the puerperium. So let's first go to the guidelines. Our guidelines state, when assigning a Chapter 15 code, remember a Chapter 15 code is our pregnancy, our OB pregnancy chapter. So when assigning a Chapter 15 code for sepsis complicating abortion, pregnancy, childbirth, and the puerperium, a code for the specific type of infection should be assigned as an additional diagnosis, because you know that first listed is going to be the pregnancy code, that Chapter 15 code. Now, if severe sepsis is present, a code from subcategory R65.2, severe sepsis, and any codes for associated organ dysfunction should also be assigned as additional diagnoses. So on my outline, I just made sure I identified that sepsis can lead to severe sepsis, which then can lead to septic shock. Because remember, sepsis is the underlying systemic infection. So whatever the underlying, whether it's a urinary tract infection or some type of bodily infection, whether it's by bacteria or virus, that can affect the whole body, which means it's usually in the bloodstream. You become septic or sepsis. And in severe sepsis is when it leads to organ dysfunction. Your kidneys start to shut down. 2 codes are required there. And then if it leads to septic shock, you run into circulatory failure. You're bringing the heart involved now because the blood is not functioning. It's not flowing like it should because of the infection. And that circulatory failure associated with severe sepsis. So how do we code that? We code the systemic infection first, followed by the R65.21 for severe sepsis, and with septic shock we assign T81.12. All right, puerperal sepsis. It says after my note, let's refer to the guidelines. So I had to actually define what is puerperal sepsis. Well, puerperal sepsis is a life-threatening infection that can occur during or after pregnancy, childbirth, or an abortion. What happens, bacteria infects the uterus and any surrounding areas after the female gives birth. The causes tend to be E. coli, staphylococci, and streptococci bacteria. And how is it treated? It's treated with a broad spectrum of antibiotics. Example, when you hear people say, oh, I've got endometritis, that's a puerperal sepsis. Or even a wound infection. I think of the C-section site, the cut, or even a urinary tract infection. These are examples of puerperal sepsis. So let's go to the guidelines. Puerperal sepsis. Code 085, puerperal sepsis, should be assigned with a secondary code to identify the causal organism. For example, bacterial infection, you assign a code from category B95 through B96 for bacterial infection in conditions classified elsewhere. A code from category A40, streptococcal sepsis, or A41, other sepsis, should not be used for puerperal sepsis. If applicable, use additional codes to identify severe sepsis, which is R65.2, and any associated acute organ dysfunction. Code 085 for that puerperal sepsis should not be assigned for sepsis following an obstetrical procedure. That's found in these guidelines at 1C, 1D, 5B. And I think I have a note that says go there. Let's see what my note says. It says, refer to page 24 of this outline. So if we look at 24 of that outline, or the guidelines, it says For sepsis due to a post-procedural infection, documentation of a causal relationship. As with all post-procedural complications, code assignment is based on the provider's documentation of the relationship between the infection and the procedure. Because remember, without that documentation, we cannot say that there's a cause and effect relationship. The doctor has to say that, the provider. And then with sepsis due to post-procedural infection, for sepsis following a post-procedural wound, such as a surgical wound or that C-section site infection, a code from T81.41 or T81.43, infection following a procedure, T81.49, infection following a procedure, other surgical site, or a code from 086.00 to 086.03, infection of obstetrical surgical wound, or code 086.09, infection of obstetric surgical wound, other surgical site, that identifies the site of the infection, should be sequenced first, if known. And then assign an additional code for sepsis following a procedure, which is the T81.44, or sepsis following an obstetrical procedure, 086.04. It says use an additional code to identify the infectious agent, E. coli, staph, strep. And if the patient has severe sepsis, the appropriate code from subcategory R65.2 should also be assigned with the additional codes for any acute organ dysfunction. For infections following infusion, transfusions, therapeutic injections, or immunizations, a code from subcategory T80.2, infection following infusion, transfusion, or therapeutic injections, or code T88.0, infection following immunizations, should be coded first, followed by the code for the specific infection. If the patient has severe sepsis, then the appropriate code from subcategory R65.2 should also be assigned with the additional codes for any acute organ dysfunctions. And for post-procedural infection and post-procedural septic shock, if a post-procedural infection has resulted in post-procedural septic shock, then assign the codes indicated above for sepsis due to a post-procedural infection, followed by code T81.12, post-procedural septic shock. But do not assign code R65.21, severe sepsis with septic shock. And additional codes should be assigned for any acute organ dysfunction. Okay, straight to that guideline as it pertains outside of pregnancy. Then we go on to talk about alcohol, tobacco, and drug use during pregnancy, childbirth, and the puerperium. And it must come straight from the guidelines. So let's look at the guidelines on alcohol, tobacco. It says alcohol use during pregnancy, childbirth, and the puerperium. Codes under subcategory 099.31, which is alcohol use complicating pregnancy, childbirth, and the puerperium, should be assigned for any pregnancy case when a patient uses alcohol during the pregnancy or postpartum. A secondary code, an additional code from category F10, alcohol-related disorders, should also be assigned to identify manifestations of the alcohol use. Was it alcohol intoxication, chronic alcoholism, etc., or even alcohol dependence? Number 2, tobacco use during pregnancy, childbirth, and puerperium. Codes under subcategory 099.33, smoking, tobacco, complicating pregnancy, childbirth, and the puerperium, should be assigned for any pregnancy case when a patient uses any type of tobacco product during the pregnancy or postpartum. It says a secondary code from category F17, nicotine dependence, should also be assigned to identify the type of nicotine dependence. And then drug use during pregnancy, childbirth, and the puerperium just says that codes under subcategory 099.32, drug use complicating pregnancy, childbirth, and the puerperium should be assigned for any pregnancy case when a patient uses drugs during the pregnancy or postpartum. This can involve illegal drugs or inappropriate use or abuse of prescription drugs. And it says secondary codes from category F11 through F16 and F18 through F19 should also be assigned to identify manifestations of the drug use, such as the drug abuse. Okay, let's go back to my outline. Poisoning, toxic effects, adverse effects, and underdosing in a pregnant patient. Refer to the guidelines. Okay, let's go back to the guidelines. A code from subcategory 09A.2, injury, poisoning, and certain other consequences of external causes complicating pregnancy, childbirth, and the puerperium should be sequenced first, followed by the appropriate injury, poisoning, toxic effect, adverse effect, or underdosing code, and then the additional code that specifies the condition caused by the poisoning, toxic effect, and adverse effect, or underdosing. And we're going to talk about that in a later section at 1C19, adverse effects of poisonings, underdosing, and toxic effects. Yep, when we get to chapter 19. All right, hopefully by now you are noticing that the key to pregnancy, childbirth, and the puerperium is to code in pregnancy. That means it should be an O code first, and for the specificity purposes, code outside of pregnancy as well at the specified code. I'm like saying the woman is pregnant, but she's got anemia. So I'm going to code in pregnancy. I'm going to go to pregnancy complicated by anemia, which is going to give me the chapter 15 code with pregnancy complicating anemia. But then I'm going to use a code at the main term anemia that's describing what type of anemia. Is it vitamin B12? Is it iron deficiency? Is it blood? What type of anemia? So again, with coding for pregnancy, childbirth, and the puerperium, we code in pregnancy and we code outside of pregnancy. But notice that the priority is always given to the pregnancy code. It is always coded first. All right, we're going to stop here at this. Next week we'll be doing normal delivery, code O80. But I want to also go back to something that I had noted on here with sepsis, severe sepsis, and septic shock. See how one can lead, if not treated at sepsis, it can lead to severe sepsis, which then can lead to septic shock. And I like to compare that to learning about systems. The smallest unit of life is a cell, but a group of cells can form tissues, and a group of tissues form organs, and a group of organs form your body systems, such as your reproductive, your digestive, your circulatory. So when you think of the different systems of the body, just know that they consist of group of organs. In my digestive system, I have the esophagus to the small intestine, large intestines, etc. Those organs. So the system consists of a group of organs, which consist of a group of tissues, which consist of cells. Okay, guys, I hope that helps you out. Thanks. I'll see you in the next video. Bye, guys.